Okay, good afternoon and welcome to this webinar, Great at Any Age. The webinar is going to tell you how you can help your older members stay healthy and reduce healthcare costs, which is a benefit to everyone. I am Mary Ablin. I'm the director of the Area Agencies on Aging Association, representing 16 regional area agencies on aging, serving seniors and people with disabilities all over the state. I am joined by Amy Florea, who is a program manager at the Area Agency on Aging based in Muskegon. And Amy is a master trainer for one of the programs, so I'm very glad she can join us. I want to start by thanking you for the excellent health care that you provide day in and day out to your older members, to all of your members, and for taking time to participate in our webinar. We're very excited about this project. It's been consuming much of our time and we are investing a lot of effort into it. We've got 1,000 employees all over the state of Michigan, and we've got a good team of people working on this among those folks. So we've got a big effort invested in this project. Now, the program significantly expands 2 evidence-based programs. The first one is called A Matter of Balance, and that's a program that is focused on helping seniors who are having mobility issues prevent falls. And as I'm sure you are aware, injuries from falls are the #1 reason for trauma-related hospitalizations in Michigan and also nationally. The second program is the Diabetes Self-Management Program, also known in Michigan as DPAD. And you might not be aware of this statistic. It surprised me when I heard it. 1/3 of Medicare beneficiaries are diabetic. So we've got a significant issue with diabetes in the older adult population. And the population for this project is older adults, 60 years of age and older. The program is funded with a generous grant from the Michigan Health Endowment Fund. And we're very fortunate to have this opportunity to really scale up these programs, which existed previously. But now we have the funding to be able to scale them up statewide. The grant ends as of October of 2016. Funding has been allocated to 16 regional area agencies on aging that, again, serve all of the entire state of Michigan, and so this is a statewide program. And we work very, very closely with the state, the Aging and Adult Service Agency, and the Michigan Department of Health and Human Services. The Aging Network was created by federal law and has existed over 40 years, and it's part in Michigan. Our 16 agencies are part of a nationwide network of over 600 agencies. The mission of the AAAs is to maximize the health and wellness of seniors as they age and to allow them to age with independence and dignity in their own homes as long as possible. We have free classes available in 2015 and through October of 2016. That's when the grant funding ends. And we have a lot of classes. We have classes, 500 classes for A Matter of Balance. This is over the 2-year period. And we have 500 classes for the Diabetes Self-Management Program known as DPAD. So there are a lot of class opportunities. The foundation was very excited about being able to provide classes in, not only urban areas, but in very rural areas that ordinarily wouldn't have this kind of resource available to them. We have over 20 statewide grant partners, and you can see I've put the Michigan Association of Health Plans first on the list. We have many other partners and partners that are not on this list. One partner I do want to highlight is ResourceLink. which is a consulting firm that works very closely with MAHP and with health plans. And Jan Getty and her team are helping us with this grant in terms of sustainability. So we're very appreciative of our partners. We could not do this alone. Now the program has some ambitious statewide goals. We're going to graduate or train 4,000 older adults in a matter of balance. That means that they'll complete a sufficient number of classes to be able to achieve the outcomes that have been proven to occur with people who complete the class. Also, the same number for the diabetes program, train 4,000. This is over a 2-year period. Now we're going to be also preparing a robust statewide training army, for lack of a better term, with 170 master trainers and 1,200 class leaders all across the state of Michigan. So the program will have a lot of training capacity because we want to reach every part of the state. We want to be able to continue these classes. Okay, the first program we want to talk about is a matter of balance. There are the matter of balance. This is a group program, a program with a small group. There are 8 sessions of 2 hours each. The sessions focus on problem solving, skill building, assertiveness training. They have a lot of group activities and discussions and some exercises. And I do want to make a comment here that the exercises are very low-level exercises. They are not rigorous in terms of what older adults are expected to do. People with mobility issues can do these exercises. The exercises can be adapted. We regularly have participants who are in their 90s and who are using canes and walkers do these exercises. So I want to urge your referrals to for all ages. There is no need to restrict the program or keep older adults in their 90s or over from attending. Now, this particular evidence-based program is unique. It is the only falls prevention program that addresses the fear of falling. And what we've noticed in working with older adults is that once a person has fallen, or if they've fallen a few times, whatever they were doing when they fell, they stop doing it. And they develop a fear, and they're afraid of falling more. If they haven't hurt themselves, they're afraid of hurting themselves when they fall. So the fear of falling means that they are less likely to move around. They're less likely to be mobile. They're less likely to do the things they actually need to do to maintain their balance and their mobility. So this program actually addresses that fear head on. It uses lay coaches in a peer-to-peer model, and it was created by Boston University. Now, Amy is going to tell you more about this program, and she has an excellent video that shows some senior participants who have completed the program and are talking about their experience. Now, the evidence for a matter of balance is something I want to go into with you because it has some very impressive evidence. It's been researched with multiple studies using experimental or quasi-experimental design. The studies have shown increased levels of intended activity, greater mobility control, improved social function, and mobility range. In terms of your return on investment, studies have shown reduced unplanned inpatient hospital admissions, reduced nursing home admissions, and studies had actually gone so far as to link program completers with their Medicare usage records and have documented lower Medicare costs. So the evidence here is, these are just citations that you can follow up on to read these reports for yourself. And the next slide, I believe, is going to have actually some of the dollar figures for the return on investment. Okay, this is a very important slide. It shows, and it's actually linked to the citation, the second citation on the prior slide. Matter of balance participation is associated with total medical cost savings of $938 a year compared with a control group. They were able to document cost savings on unplanned hospitalizations, skilled nursing facility admissions and care, and cost savings in home health care. And what they did find, though, is that participation was also associated with increased use of physician office visits, physical therapy, and occupational therapy. And this is exactly what we want to happen. We want older adults, when they start falling, to not just sweep it under the rug and pretend it's not happening, kind of go into a denial. We want them to actually go to the doctor, tell the doctor, hey, Doc, I'm having trouble with my mobility here, I'm falling down, what can you do to help me? And order physical therapy and occupational therapy to prevent further falling. And this is the scenario that was shown through the CMS study that I cited earlier. Now, the second program is the Diabetes Self-Management Program, or DPAD. It was created by Stanford University School of Medicine, and it is a part of a suite of evidence-based programs that Stanford has created for any number of chronic conditions. And they're well known. They're actually international. So these programs are very widely disseminated across the world. Now, the program was designed for people with type 2 diabetes, and it was tested on people with type 2 diabetes. However, we tell people that if they're pre-diabetic or if they're type 1, they might also benefit. And so we don't bar people from taking the classes if they're in those situations. However, there are other evidence-based programs that might fit their situation better. The program consists of 6 small group sessions. Again, this is a group class environment of 2.5 hours each, taught by lay leaders. Many of them have diabetes or experience with diabetes. And it addresses physical and emotional symptoms, exercise as you would expect, healthy eating, obviously medications, and working effectively with healthcare providers. And I do want to make a mention here of the emotional symptoms, because there is a growing body of evidence that diabetes is linked to depression. So people with diabetes can, when they feel low, they feel down, they stop taking care of themselves. And in fact, I was talking to a friend just this week who had a sister who was in that very situation and was feeling depressed and stopped monitoring her blood sugar. So this program will actually address the emotional aspect, and it's very important. So the program does use this small group dynamic, which actually develops into kind of a support group. So seniors interact with each other, they make weekly action plans, they share experiences, and they help each other problem solve. Now, there's also return on investment evidence for the Diabetes Self-Management Program. Again, the program was researched with multiple studies, experimental and quasi-experimental, and the studies show significant improvements in symptoms of hypoglycemia, healthy eating, reading food labels, which is very important, communicating with physicians, depression, patient activation, and self-efficacy. And again, this is the aspect of your members actually taking control of their own health and starting to be proactive in monitoring and doing the things they need to do to stay healthy. For return on investment, I do want to highlight studies have shown fewer emergency room visits. Very important. And if people are communicating with their physicians, they're tracking their health and their blood sugar, insulin usage, medication usage more effectively, people tend to be taking care of themselves. There are fewer surprises and fewer emergency room visits. And one very impressive thing is that the participants of this program maintain those improvements even 1 year after the program was over. So here are some of the citations for the evidence that you can check out and read for yourselves. Now, I do want to talk a little bit about evaluation for this program, because the program is a grant from the Michigan Health Endowment Fund, which is a foundation, and it has a very big interest, a very strong interest in evaluation. And the evaluation for this project is very robust. We've hired public sector consultants here, a research firm based in Lansing, to do a very intensive evaluation for us. So the evaluation, of course, will involve process elements and process questions like, are healthcare providers referring their patients to the program? How do seniors hear about the classes? Do incentives help? Why do people drop out? With evidence-based programs, there is a big issue with participants signing up and then not completing. So we want to find out, why do people not finish? What is keeping them from finishing? And then we'll have better evidence in terms of what to do to prevent that from happening, to address that. A lot of folks on the national level are watching this project because we are going to be gathering some very helpful data on these questions. And these are national questions, not just questions for people in Michigan. But we're also going to do outcome evaluation. We're doing pre and post tests for the classes, but in addition to that, we're going to do follow-ups 6 months and 12 months after participants graduate from the programs. And we're going to find out, have the benefits, have they stayed with you? Are you maintaining your ability to be mobile, to have avoid falls and avoid hospitalizations and so on? Are you finding yourself better able to manage your blood sugar, to keep your, to prevent any kinds of side effects from uncontrolled diabetes? 12 months, 6 months and 12 months after program completion. So we're very excited about this evaluation because it's going to give us some great data on the effectiveness of this very project in Michigan. Now, we do have some incentives for participants to participate, and we want to encourage people to participate and retain them once they actually do sign up for the classes. So to do that, we're providing snacks and meals in the context of these classes. We do have funding to be able to provide transportation assistance. We think that difficulties with transportation might be one of the significant barriers keeping older adults from attending classes. They might not be able to drive, or they may need a ride from somebody else, and the other person is not reliable or is not able to provide transportation every time they need it. So we're providing transportation assistance in the hopes that that makes a difference. We're holding classes where seniors already congregate to make it as convenient as possible for older adults to participate. And we're offering attendance and completion incentives such as pedometers, water bottles, small gas or grocery gift cards, and to see if is an incentive for example, if you complete the program, you'll get a gift card. Does that make a difference with seniors? Things like goodie bags with healthy food items might be something that would make people excited about attending the class. So we're trying everything. To refer people to our classes. We're asking you to refer your members who are 60 plus with mobility issues to our Matter of Balance classes, and refer your members 60 plus with type 2 diabetes to the diabetes self-management classes. The classes are offered statewide. And as I said, we have a lot of classes available, a lot of capacity, and we're trying to fill the classes. You can find the classes using our website, greatatanyage.com. And at this point, I'm going to see if we can switch to that website. Okay, so I'm hoping you're seeing the website now. And the website has a search feature. Find a class near you. And we'll click on that. We'll click on that feature, and it shows you a screen with a feature by county. So let's say we'll search by Wayne for Wayne County. That's an area that has a lot of seniors. So the website brings up the name. There are actually 2 area agencies that serve Wayne County. One is Detroit and these other neighboring communities, and the second one, all of the other areas of Wayne County. Now, you can go to their websites, and their websites are shown here. You can go to their websites and actually search for their class schedules, and we're asking them to put their schedules on their websites. I'm going to tell you, though, that the easiest way for you to refer your members is going to be to call the agencies. Call them, or have your member call them. And a person at the agency can tell them what's available, can help them with logistics, with transportation assistance, or anything else they might need as a support. They could also help them. Perhaps the closest class to them is in another region across the county boundary. So they could also help them with that aspect of finding the best class for them. We are scheduling classes through the cold weather months, so there will be classes available up through October of next year for this project. Okay, so this is my contact information, and please feel free to email me with any issues you have, any questions, any follow-up. If you want any further information about the programs, and I'm very happy to answer any questions and hear any comments you have. Okay, so we do have a question. How do we get transportation for a patient waiting to go to the PATH classes? I would say call the agency, call the Area Agency on Aging, and ask them for transportation assistance. Okay, so now we're going to switch to more details about the 2 particular classes. And Amy Floria from the Area Agency on Aging in Muskegon, who is a master trainer for a Matter of Balance, is going to start by talking about a Matter of Balance.
Good afternoon. Yes, I've been asked to share some of the elements and activities that comprise the workshops. We're going to start with Matter of Balance. Before I go much further, we're going to put up some quick statistics about the prevalence of falls. This is probably no surprise to any of you, but many older adults sustain falls within a year. These are national statistics. One of the things we know is that we can't give them a pill and ask them not to fall again. Just not possible. However, as Mary talked about, Matter of Balance is one of the only workshops that talk about that fear of falling. We know that the fear of falling causes a cyclic effect. They're afraid of falling, they restrict activities, they become weak because of that. Because they're weaker, they believe that they cannot continue and do activities they once did, which causes more weakness and isolation. So from the very first session of Matter of Balance, we begin to identify and talk about the beliefs about falling. Oftentimes we hear, well, we're just getting old. It's more difficult for us to stand up out of a chair, or we can't walk as far as we once did because we're getting old. So we start to talk about, from that first session on, misconceptions, self-defeating thoughts, and how to shift from those self-defeating thoughts to self-motivating thoughts. Sometimes it's related to embarrassment about exercising. They think they have to get into a suit and go exercise like we did back in the 80s, or what's going on with friends and family telling them they need to slow down. Oftentimes there's some input from friends and family asking them to restrict activities so a fall does not happen. So we start talking about what's really off the table, what's really not something that you should be doing, climbing ladders, for instance. What constitutes a risk? Where is extra caution warranted, and where is it not? And oftentimes, as you talk about those things, people, the rest of the group has input as to what constitutes something that's on the table, off the table, or just where you should have a little extra concern. Of course, exercise is an important part of the Matter of Balance program. In the third week of the 8-week workshop, we begin exercises. Now, these just aren't any exercises. As Mary mentioned, they're exercises that are specifically targeted to build strength, to increase flexibility within the older adult. They're not difficult exercises. So, oftentimes people arrive in, like a sweatsuit and tennis shoes, and that's the appropriate wear, but we're not actually going to be sweating. We start very, very, very slowly. We look at concentrating on simple exercises in the heel courts, in the ankles and the hips, where we know that most of the balance pressure, or most of the balance points are. They learn about physical factors, low blood pressure, weakness, poor flexibility, and then exercises that are specifically targeted to counteract those issues. Oftentimes we start out with super low repetitions, maybe doing things once or twice, and by the end of the 8 weeks, most of the participants who are encouraged to do these exercises at home each day have built up quite a bit more endurance and are very pleased with their performance. In addition, we talk a lot about identifying home and community fall hazards. We conduct a comprehensive home safety assessment. Each participant in the workshop receives a Matter of Balance workbook. It includes all of the exercises and instructions on how to do them, as well as worksheets. And one of the worksheets is an 8-page assessment of their home, going through each room of their home, looking for potential fall hazards that could increase their risk for a fall. Simple things as you may think of scatter rugs and things like that, but then more detailed things related to handrails and grab bars and things like that. Also, a guest therapist comes in, a physical therapist or an occupational therapist comes in at one of the workshop days, usually the 7th week. Those physical therapists or occupational therapists are trained in the Matter of Balance program and the exercises. It's an excellent opportunity to ask, how can we adapt a certain exercise if they don't have certain mobility, or if they have issues related to a hip replacement or a rotator cuff. It's a good time for participants to ask those specific questions. In addition to that, the guest therapist talks about exercise opportunities. They'll bring in like Nordic walker canes and things like that help the participants get a broader view of what's available to them in the community. And exercise-wise. Community fall hazards. I talked about at the beginning of the workshop identifying those things that are risks and what really does constitute a risk. And so often as people restrict their activities, they restrict activities out in the community as well because they're concerned about falling. So we really take a lot of time to talk about what is it you want to do in the community, and is it actually something where you can look at adaptations to the activity, or you can be more assertive about your needs. And the story that I like to share about that is one lady, a grandmother whose granddaughter was in high school swimming. She had stopped going to her granddaughter's high school swimming meets because the observation area was above the pool, and it was difficult for her to climb the stairs to get there. And she had fallen one time on those stairs. So as she talked about that and how that really was difficult for her to miss those because of the fall risk, the group started giving her ideas. Well, is there observation area for people with disabilities? She said, yes, but there's often other people sitting there, like kids and things. And they said, well, maybe you could kindly ask if they could give you some of the space there so you could go. Another person offered the idea, what if you hold on to the rail and then hold on to your husband's arm on the other side? And she seemed interested, and at the next meeting, at the next workshop sessions, she reported back to the group that she did go for the first time in a long time to her granddaughter's swim meet. And she said, I asked if I could sit in the area where that was reserved for people with disabilities. And of course everyone was kind and allowed me, and she was very, very pleased to have kind of jumped that hurdle and gotten back into the community and doing things that she wanted to do. In addition, participants will learn about community resources. We talk about all community resources available: brainstorm, problem solve, options, as well as barriers and solutions. Sometimes people talk about, oh, I've always wanted to do swimming or water aerobics or things like that. I just never know where to go. I never know what time it is. And usually someone within the group is able to share ideas and opportunities with them. And it becomes, why don't you go? Why don't you try that? Well, sometimes the barrier is I don't want to go alone. Sometimes the barrier is availability or rides. And oftentimes those connections can be made, and people find activities and exercise in the community that they enjoy doing by the end of the 8-week course. And I also have some more local endorsements. This was a video kind of with participants talking about the value of the program to them. But more locally, Becky, one of our participants, said, it is most important to do the little things every day to strengthen your ankle and leg muscles. They are your prime ways to successfully manage a fall. If you don't, you're at the mercy of a fall, of gravity, of momentum. If all it takes is 30 minutes a day to keep me strong, I'll do it. And then a coach, Becky, said, I found that many of the participants didn't think they were capable of exercising for one reason or another. After completing the class, I noticed a huge revelation for many of the participants. They've not only learned the tools and techniques to manage their concerns about falling, but they have thrived within the social atmosphere and begun making exercise a regular habit. I don't think those endorsements are anything out of the norm. We get much positive feedback over the Matter of Balance program. So we'll go on and talk a little bit about the Diabetes Path program. I'll show a couple of national statistics. I'm sure it's of no surprise to you that about 1 in 4 people over the age of 65 have type 2 diabetes nationally. And you probably all know better than me the potential complications that unmanaged diabetes can create for a patient. So within the 6 weeks of the Diabetes Path program, patients will learn basic information about diabetes, the management. They'll develop a weekly action plan. And within that action plan, a lot of problem-solving techniques. The action plan occurs from the 1st week through the 6th week. And what it does is it creates an environment for the participants to talk about what they want to do this week, how long they want to do it, how often they want to do it, and then rate their confidence level. So for instance, if a participant wants to increase their exercise, they'll make a very specific goal related to that. I want to walk twice a day, 3 times within the next week. And my confidence level is a 7 out of 10. It's 1 through 10 confidence level. If they aren't at least a 7, 8, or 9 in the confidence of being able to accomplish that goal, the group works with them to problem solve barriers and possible solutions to those barriers, in a way affecting positive peer pressure to accomplish the things they want to accomplish and create that habit of action planning. You can see there Sharon, a participant in one of the Diabetes Path classes, said, I developed goals each week and accomplished them. I never imagined doing that before taking the Diabetes Path workshop. Of course, patients and participants of the workshop will talk a lot about causes and treatment of low blood sugars, and then a formula for eating healthy and nutrition planning. Mary mentioned there's a time for refreshments at each of the sessions. Many of the groups even morph into a larger meal than that, creating a 45 to 60 carb meal that's either served before or after the sessions. They use seasonal foods as well as ethnic preferences and work together to show how small alterations in meals can help cut fat and carbs out of those meals. One of the group's actions plans, 2 of the people decided that during the week they wanted to devise their own 45 to 60 carb meal and prepare it for the rest of the group at the next session. And I was told that it was a huge success. This sort of thing is very fluid, however. It depends on the abilities and the needs of the group. So the lay leaders who lead the class are very fluid in that, depending on the abilities of the group at large. We also talk about 9-inch plate size, serving size, and all of the issues that might go towards more healthy eating and formula for healthy eating. Of course, healthy eating and exercise go hand in hand. Within the group structure, there's an illustration of simple exercises. Assist participants in recognizing what's aerobic exercise, what's flexibility and strength, how much exercise you need every day, what exercises to do every day, what exercises not to do every day. And then when is the best time for a diabetic to exercise, 1 or 2 hours after any meal. Exercise is a great way to manage stress, and we talk about that too. But in addition to that, we talk about the effects of positive and negative ways to deal with the emotional concerns of having a chronic illness such as type 2 diabetes. There's guided imagery, progressive relaxation, belly breathing exercises. And lots of times after that information is presented to the group, many of them will incorporate those sort of relaxation techniques into their action plan in the next week or 2. We also talk about the power of the mind. Mary talked about depression and people with type 2 diabetes. One of the examples we give them is, we have them close their eyes. We have them visualize holding a bright yellow lemon in their hand, smelling that lemon, feeling that lemon, and then taking a huge bite out of that lemon. Many times, just the thought of taking a bite out of a lemon will produce a salivatory response in participants. And it's just a really simple illustration of the fact that your mind and your body are connected. And what you think often affects your body in ways that maybe you're even unaware of. Of particular interest to healthcare providers is the fact that patients and participants will learn skills for communicating with health professionals and proper skin and foot care. A lot of times people of a certain age have difficulty talking to their physicians, maybe even out of fear for the physician knowing how bad things really are. But we talk a lot about the importance of effective communication, ways to follow a medication regime, ways to communicate with your family, maybe even bringing someone along to a doctor's visit. We talk about checking feet, proper skin care, recognizing changes in foot conditions. If it's hard to see the bottoms of your feet, to buy a mirror so that you can check them every day. Things like visual cues for you and your doctor. When you go to the doctor and you get your vitals taken, before the doctor comes in, remove your socks and shoes so that it's a visual cue to both you and the physician that you need to have your feet looked at to maintain that healthy skin care. Just basic awareness of the overall condition of your body, hydration, drinking water. Here's a reference page as to where some of this information is found, and my contact information.
Okay, at this time, we're going to ask you if you have any questions. Please enter the questions in the questions section of the webinar tool. We'll try to answer as many of them as possible. And again, I want to emphasize, if you have any follow-up questions after this webinar, you can always direct them to me, and you have my email address in the PowerPoint. Now, I do want to mention you will receive an email after this webinar with the recording of the webinar, and it's going to be linked to the GoToWebinar app, and participants can access from that link. So are there any questions? Any comments? Okay. Oh, let me ask them a question. Let me ask you a question. Is this a program you think you might be interested in referring your members? Are these programs something you might be interested in referring your members to? Okay, and we do have a comment. Details of both programs would be very helpful. We do have an attachment with a summary of the curricula for both programs, and that will be sent. If you have couples attending the class, how do you encourage one spouse to speak if the other spouse is dominating the conversation? That's an excellent question.
You know, sometimes what we do is we set timers. If we have a really chatty group in a very positive way, we'll say, oh, there's so much conversation going today. We're going to limit each person's conversation to 1.5 minutes or 2 minutes until everyone's gotten a chance to talk. It's just one facilitation technique that could be used.
Okay, thank you for asking that question. We do have a comment. These programs do work, and I love seeing the progress of my patients and the wonderful things that come out of these classes. Excellent. We love to hear that. And we do, as I've mentioned already, we do pre and post tests, we do an evaluation, and we welcome all comments about our program and our classes. Okay, I'm not seeing any other comments or questions, so we're going to thank you for participating today, and look forward to working with your members and helping them improve their balance, prevent falls, maintain their health in spite of type 2 diabetes, and reduce healthcare costs.